If the dog leads the man is blind, and if the man leads the dog, the man is married. Chinese proverb. Pet therapy. Dogs can have a dramatic positive influence on stroke victims, regardless of the type of stroke one has suffered and survived. Service animals, also referred to as assistance dogs, can help people with some type of disability, including stroke victims who often suffer from visual or mobility impairment. These dogs can help with cognitive recovery, remembering commands and the pet's name, as well as getting out to walk. The dog can help for faster recovery both physically and emotionally. Additionally, dogs tend to respond well to training and have the temperaments to be good companions. Walking a dog provides much-needed physical exercise, which leads to improved mobility and a healthier lifestyle overall. The ability to have something to pet or touch can result in lower blood pressure, normal heart rate, and reduced stress. Pets provide emotional stability during stressful situations, helping to reduce anxiety and depression. Survivors of trauma, illness, or injury often find comfort and support from companion animals during the process of brain rehabilitation. From the daily comfort of your own dog or cat to specially trained animals for therapy and assistance, dogs, cats, horses, birds, and other animals can provide confidence, relieve loneliness, provide motivation or assistance with walking and other movement, and generally give a sense of purpose to life. Studies have shown that pet ownership has psychological benefits. Interacting with a pet has been linked to lower blood pressure, increased exercise, and stronger immune systems. Pet owners tend to be less lonely, have higher self-esteem, be more extroverted, and harbor less fear about getting close to other people. For those in recovery from brain injury or stroke, an animal can boost recovery efforts. A pet can provide relief from loneliness. Having a stroke or brain injury can be an isolating experience. If the survivor also has aphasia, it may feel difficult to communicate with other people. An animal provides comfort, company, and stimulation, as well as a pathway to a less isolated life. Help with aphasia. Pets may encourage individuals with aphasia to try to communicate. When out and about with a dog, for example, a pet is a great conversation starter, giving survivors more opportunities to practice talking with strangers. A sense of purpose. Pets may provide the comfort, confidence, and motivation survivors need to keep up rehabilitation. Service animals. Usually dogs, or even miniature horses, who are trained to help people with disabilities such as visual impairments, mental illnesses, seizure disorders, or diabetes. If a person recovering from a brain injury, a service animal may provide assistance with balance or walking. Service dogs often live with their humans, and may enter environments otherwise closed to animals, such as restaurants, by right of the Americans with Disabilities Act. Not just for emotional support. Household pets can provide significant support during brain rehabilitation, but in addition, there are specially trained service and therapy animals who may provide additional assistance, depending on the needs of the survivor. Service animals may fall into the following categories. Therapy animals. Also known as AAT, animal-assisted therapy. These animals, usually dogs, are trained to provide comfort and affection to people in schools, hospitals, and clinics. One therapy animal may serve many people in a therapeutic setting. Emotional support animals. Known as ESAs, these trained animals may provide therapy through companionship. You can think of ESAs as pets who have the right to enter some environments otherwise denied to animals, such as airplanes, upon following proper procedures. Lessening negative emotions. Brain rehabilitation is difficult and can take an emotional toll on survivors. Pets offer acceptance, love, and motivation. Even just petting an animal can provide a calming and comforting effect that may help with mental health. Motivation to move. A pet can provide an incentive for survivors to work rebuilding walking ability. Clinicians report seeing patients walk further with a dog on a daily walk than without, because they are distracted by the dog and aren't aware how far they are walking. In addition, activities like brushing a pet, feeding them treats, and putting a leash on and off can act as exercises to help increase motor recovery. Things to put into consideration before getting a dog. 1. Your reason for getting one. Why do you think you need a dog? For security reasons, for companionship, because of peer pressure, for health purposes. 2. What are your family members saying about it? If you are not getting a dog as an individual and you have a family living with you, you need to consider what your family thinks about it. 3. Can you commit to the dog? Can you commit to the dog and for how long? Will you be there for the dog and its puppies when it reproduces? Can you feed the dog regularly and handle its appetite? Can you see to the care of the dog, health-wise and body-wise? Point 4. Your lifestyle. Does the dog or your pet fit into your lifestyle? You do not want to merely choose a dog because of what it looks like without knowing whether it will fit into your lifestyle, work, health, etc. 5. Do you prefer an adult dog or a young puppy? You need to decide whether you want an adult dog or a puppy. 6. Is your home danger-free for the dog? To prevent accidents, you need to take away things that can harm them like cords, poisonous food, etc. People recovering from brain injury may benefit from each of these animal-human relationships. If you and/or your loved one are interested in learning more about how animals can help brain rehabilitation, there are a number of resources online for learning more about service animals, ESAs, and AAT. I am a stroke survivor and please let me know about your opinion in comments section. Thanks. Please give me a favor by subscribing to my YouTube channel SDK Online Stroke Awareness. Please give me a favor by subscribing to my YouTube channel SDK Online Stroke Awareness.